Let me tell you about angular cheilitis today. Angular cheilitis means you have inflammation of the angle of the mouth. So angle of the mouth is the area where you have maximum movement in the facial area. So this area, because of maximum stress and movement, it is subjected to trauma. Usually this area you have maximum stretch area and it is mucocutaneous junction too. So if without any irritating factor, you will not be having any problem there. So in angular cheilitis, if there is some irritating factor, this can result in angular cheilitis. So angular cheilitis, you can divide into two types, either acute or chronic. Acute means the patient complaint is only for few days. Chronic means the patient complaint is for few months. See, as you see in this picture, this is a picture of chronic angular cheilitis. In acute angular cheilitis, usually the patient complaint will be, and the finding will be, there will be redness here on both sides. And in chronic, as you see in as I have shown you in the picture, it will be hard, and if you touch, there will be slight bleeding also. So I told you that without any reason, usually it doesn't come. So what are the irritating factors? The common irritating factors, let me tell you. Those patients who are using dentures, if they are not properly taking care of the denture, or it is old and they are not replacing it at the proper time, because of this cause, it can lead to angular cheilitis. The other factors being riboflavin deficiency or vitamin B12 deficiency, or if the patient is anemic, or the patient is diabetic and blood sugar is high, is not under control, or the patient has got some skin eczema problem, or you have some children who have the habit of mouth breathing. There will be some cause for that. So that cause has to be investigated and removed. And in syndromic children like Down syndrome, where the tongue is big and they open and breathe, mouth breathing, this also can result in angular cheilitis. These are the common irritating contributing factors for angular cheilitis. Now, already I have told you the presentation. If it is acute, they will say burning sensation. If it is chronic, they will say dryness, and if they touch, it will be bleeding from that area. Now, if you ask me, is there any specific test? The answer is going to be no, especially so if it is acute. If it is chronic, I would like to do simple blood tests like CBC, ES, C-reactive protein. Usually, this blood test will be normal. And the most important being, if the patient, especially if the patient is diabetic, we have to do random blood sugar. And if it is high, fasting blood sugar and postprandial blood sugar, and of course, hemoglobin A1C, so that we can give a good control of blood sugar. Now, we can take swab from these corners for bacterial study and fungal study. So we have done with investigation. How are we going to treat it? The most important part is we have to remove the irritating or contributing factors. I have listed a few. So we have to take care of the denture, proper maintenance of the denture. If diabetic, control of diabetic. Anemic, correct that. And supplement vitamins so that we can riboflavin and vitamin B12 deficiency can be taken care of. And if the child is mouth breathing, you have to investigate accordingly for that and treat it so that he doesn't have the habit of mouth breathing. So first we have to treat the irritating or contributing factors. Now coming to the treatment, we can give cream if it is bacterial, antibacterial cream, and fungal is antifungal cream. So whichever cream you are using, you have to use 2 times daily. Antibacterial for 7 days and antifungal. If you are using antifungal, it has to be for 2 weeks. Now, once you have applied the cream, it has to stay in that area for at least for 2 hours. So better you take it after breakfast and after dinner. So the contact period for the medicine at least should be minimum 2 hours so that it gives maximum effect in that particular area. Now, once this treatment is done, immediately it doesn't become normal. So it is better that you take some supplement, some other treatment along with this, which I'm going to tell you, like home remedies. And this is a preventive measure also. So you can apply coconut oil here, or aloe vera or honey or cucumber or any moisturizing agent or even castor oil, olive oil, and in the market you get this moisturizing agents and lip balm. So this lip balm, it stays longer than 2 hours. Well and good, that's good for it. Now the simple another solution is yogurt. So yogurt is little semi-solid. It doesn't stay for long, but is a very good moisturizing agent. That too can be used. So this is how we manage angular cheilitis. Thank you so much.